Uh, Good morning, everyone. My name is Kiramatullah, and today I am presenting for work title Cardio Vit-CAM Self-Supervised Vision Transformer with Class Activation Mapping for Interpretable Congenital Heart Disease Detection. This work is conducted in collaborations with my co-author. In this research, we propose an explainable deep learning framework for detecting congenital heart defects using echocardiography data. Here is the contents of my presentation. The first one is introductions, then motivation, data set, methodology, result, and discussions. The first one is introductions. Congenital heart disease is a structural problem of the heart, a nearby blood vessel that is present at birth. Congenital heart disease is a major global health issue affecting millions of newborns annually, with its birth prevalence peaking at 9.41 for 1,000 live births 2010 to 2017. It remains a leading cause of death under 20 years with 250,811 global deaths in 2021, mostly in infants under 1 year. In Pakistan, 60,000 CIT births occur yearly with a 44 out of 1,000 live birth mortality rate, but timely intervention can improve survival by up to 90%. So congenital heart disease or CIT refer to structural abnormalities of the heart that are present at birth. It is a major global health problem affecting millions of new borns every year. So, congenital heart disease is the most common severe congenital anomaly. Affects 1.3 million newborns annually worldwide. Global prevalence 7 to 12 per 1,000 live births, highest in Asia. So, among different congenital heart defects, this study focuses on three major types: atrial septal defect. The second one is ventricular septal defects. The third one is atrioventricular septal defect. So I discuss one by one. The first one is atrial septal defects. Atrial septal defect is a hole in the wall septum between the two upper chambers of the heart. The second one is ventricular septal defects. Ventricular septal defect is a hole in the wall septum between the two lower chambers of the heart ventriculars. The third one is atrioventricular septal defects. Atrioventricular septal defects is a serious heart problem where there is a large hole in the center of the heart affecting both the wall between the upper chamber atria and the wall between the lower chamber ventriculars. So here I discuss echocardiography importance. So here transthoracic echocardiography means TTE, including 2D imaging and color Doppler, is the primary diagnostic tool for CD. It provides visualization of cardiac structure and blood flow patterns. However, early screening of SD, VSD, and AVSD remains challenging even for experienced cardiologists. So here is motivations. Current CIT diagnosis is highly dependent on expert interpretation, which can be time consuming and subjective. This may lead to miss or delayed diagnosis. Therefore, there is a strong need to develop accurate interpretable AI-based system to support clinicians in early CIT detections. Now the data set. For this study, we use a private echocardiography dataset collected from Lady Reading Hospital, Pakistan between 2020 and 2024. The dataset contained 1,600 TTE videos, approximately 74,000 extracted frames. From these, 6,000 images were labeled by two senior cardiologists for supervised training. All data were anonymized and approved by the Institutional Review Board. Methodology. Our proposed framework called Vit-CAM consists of two main stages. The first, we perform self-supervised pre-training using a mask autoencoder with a vision transformer to learn general codic features. Second, we perform supervised fine-tuning by classification ASD, VSD, and AVSD. Additionally, we apply Vit-CAM++ to provide interpretable visualization of model predictions. So, dataset split to 72% trained and 8% validation and 20% test. And Vit-CAM++ applied for interpretable class specific heat map. So it is the overview of the methodology. So the figure illustrates the overall architecture of the proposed system. Enable echocardiography frame are first used for a master encoder pre-training. Then the pre-trained encoder is fine-tuned using level data per classification. Finally, Vit-CAM++ highlights a diagnostic region and contributes to model predictions. Now the results section. We evaluated multiple visualization methods including Vit-CAM, ScoreCAM, and Vit-CAM++. All models used to the same pre-trained architecture. The only difference was the visualization techniques. Among them, Vit-CAM++ achieved the best performance across all evaluation metrics. Comparison and visualization metrics evaluated multiple gradient-based visualization method dataset. All models use identical VT-V16 plus MAE pre-trained architecture. Only visualization techniques differ. Vit-CAM++ demonstrated the best performance across all metrics. So here is the table. So Vit-CAM, the table summarizes the classification performance of Vit-CAM, ScoreCAM, and Vit-CAM++. Vit-CAM++ achieved 97.03 accuracy, 97.04 precision, 97.03 recall, 97.03 F1 score. The result demonstrates strong diagnostic capability of the proposed framework. So here is the bar graph. A comparison of Vit-CAM, ScoreCAM, Vit-CAM visualization per CG across 4 evaluation metrics. Vit-CAM++ achieved the highest accuracy, precision, recall, and F1 score. So here is the confusion matrix. The confusion matrix shows the classification result across all the 3 CID classes. The model demonstrates high accuracy with minimal misclassification between ASD, VSD, and AVSD. The model performance in classification, classifying CID with an overall accuracy of 97.03 across the 3 classes ASD, VSD, and AVSD. True positive are high for ASD 428, VSD 339, and AVSD 283, while misclassification is minimal. For example, 16 VSD cases predicted as AVSD and 14 AVSD cases predicted as AVSD. So now Vit-CAM++ visualization were main results. So Vit-CAM++ visualization highlights regions that strongly influence model predictions. Warmer color indicate areas of higher importance. These visualizations confirm that the model focuses on clinically relevant codic structure, improving trust and interpretability. So here is the interpretability of the model using Vit-CAM++ visualizations. So these examples show Vit-CAM++ heat map for ASD, VSD, and AVSD cases. The highlighted region correspond to actual defects localization, demonstrating the clinical reliability of the proposed system. So it is the comparison of visualization method for CT classifications. So here I compare 4 paper with my results. So my result is, so my method is cardio Vit-CAM works, and the method is MAE plus VAT plus Vit-CAM plus classes. I use 3 classes: ASD, VSD, and AVSD. The data sheet is 74,000 images per pre-training and 6,000 for fine-tuning, and overall accuracy is 97.03. So here is the conclusion. In conclusion, we propose a cardio Vit-CAM interpretable deep learning framework for automated CHG classifications. The model integrates mask autoencoder, self-supervised pre-training, vision transformer for fine tuning, Vit-CAM plus explainability. The system achieved 97.03 classification accuracy and shows strong potential for clinical decision support. In the future work, we plan to extend this framework to precisely localize a defect region, quantitatively measure defect size, expand evaluation using multi-center clinical data sets. Thank you. Thank you very much for your attention. Thank you so much.